Hello, good good day everyone, and welcome to my channel on air pharmacist. This particular session is going to be about the smoking cessation support program of the on air pharmacist, and we'll be talking about some modules like 5 modules. So, in order for you not to miss the other modules that will be taken, I would implore you to like, subscribe and share with those that might be interested in this video. Of course, as you do that, you won't be missing the subsequent modules that will be taken. So we have 5 modules in all. Without wasting our time, I want to thank you again for joining. And I will say that this particular module is about you having the basic knowledge of tobacco use and addiction in order to be able to support those that are dealing with tobacco's smoking cessation issue. And I would first of all ask that why do people smoke? A lot of us, you could drop why you think people smoke in the comment section to get to understand how you feel about it. But what we do know as professionals is the fact that biological reasons are one of those things that influence people smoking. And when I mean biological, I'm talking about the effect of nicotine that is in the cigarette on the biological system on our brain. So it creates a reward system that makes someone want to go back and over to smoke again. The other reason is psychological factors. So a lot of people get passive stress release when they smoke cigarettes, and boredom push some people to taking cigarettes. Of course, this becomes an habit when they do it over and over again. You also agree with me that the social factors, including the peer influence, a lot of people have peer pressure pushing them into taking cigarettes, or even the peer influence. Let's use this peer influence because a lot of time just having people that smoke around you might push one to also trying to smoke. So accidentally you become a smoker, and then it becomes an habit over time. And I can tell you that the habitual or the continual advertisement of cigarettes on our televisions, in our medias, is actually pushing a lot of people to get into smoke as well. You would see on television where football musician rather musicians, they do smoke on the screen. Movie producers, actors smoking on the screen, and that encourages some persons to want to have a feel, want to have a feel of the smoking, or want to form a class with those that smoke as well. That's how people start smoking and eventually becomes an habit with them. So there's also situational trigger. A lot of persons have been into, gone through life issues. Some people feel depressed at some point in their life, and they get into smoking by chance. Before they knew it, it becomes an habit. Some people, because whenever they are in a gathering, everyone is smoking around, they want to also be part of it. They want to also form, they belong to that class of people. They don't want to feel isolated in a social gathering. They become smokers as a result of that too. Now, when you smoke, the brain has feel something from you smoking. When you smoke, in just less than 10 seconds, it releases nicotine into the bloodstream. And this influences the release of dopamine. Dopamine hormone is a pleasure hormone, and that creates a feeling of pleasure, a feeling of pleasure that lasts for just a few minutes or thereabout, after which you crave to have more of those feelings, after which not taking them could also mean you feel some symptoms of withdrawal, and this push the person to continue to have this feeling, and you continually want to have the cigarette. Other reason is over time the brain becomes addicted or become acquainted to that dose of nicotine that you are taking. I'm talking about the dose because if you take just 2 cigarettes, 2 sticks in a day, after some time, that feeling of you used to have when taking 2 sticks becomes um, non-existent, and you want to try to upgrade to be able to get that feeling. and that makes one to continue to smoke almost perpetually. Now, the cycle of nicotine, I've just explained now, is the same thing. But when you withdraw, there's a feeling of anxiety. You become so anxious, you want to take the cigarette. Some people become jittery, they become so irritable and restless to the point that until they are able to take that cigarette, they won't be at ease with themselves. Now, the importance of talking about all of these things, you agree with me, is the fact that it has long-term and short-term effect on our health. One of the short-term effect is the fact that on taking cigarettes, the heart rate increases. There's of course the bad breath that comes with smoking cigarette, that a lot of them want to isolate themselves just after smoking. Or some cases, I've heard case from smokers trying to quit, saying they use they chew some things just to make the bad breath go away, or to even use perfumes just to be able to make the bad breath go away. And also in the short time, the reduction in lung function has been established as one of the consequences of smoking. Now, these are on the short time, but on the long time, you agree with me that these would aggravate the situation of the lung functioning, and that could lead to COPD, where the functioning of the lung is compromised almost completely. And of course, it could also lead to lung cancer in a long time. And this could also result in heart diseases, including hypertension, stroke, and the rest that you have around. Now, beyond the smokers harming themselves, they also pose risks to the public, and that is why you've seen policies, you've seen laws restricting people from smoking in public places. However, even when they don't smoke in the public places, they smoke in an enclosed environment with some other persons, healthy persons, some other non-smokers within their vicinity. So they pose a risk to the health of these people as they increase the chances of these people having heart disease or even having lung disease as well, lung cancer and the rest as well. Now, a lot of time people would want to smoke, but then the approach of smoking is also different, and they get a lot of information that are not true. So they are, when we keep quiet and we're not talking about it, we're not giving them the opportunity to get the right information to be able to quit. Now, one of those false information that is not helping people to quit is the fact that people have said that the only way to succeed in smoking is to abruptly stop smoking. So you're smoking like that, you just stop abruptly without any help. That is far from being the truth. And the truth is that if you have to stop smoking, if you have to quit smoking and succeed, beyond slowly reducing the dose of cigarette you smoke, you will also need behavioral support. And of course, you will need help to take medication. It's interesting to know that there are medication that could help you to stop smoking and increase the success rate of you quitting smoking. Another is the fact that a lot of people have said that if you have to stop smoking, you could do electronic cigarette. Some of us might not be very familiar with electronic cigarette, but of course, it's just some kind of cigarette that uses chemicals. People, take it and they feel a little bit relieved from the cravings. However, it is also not safe. I have to say it again, it is also not safe. Don't forget this particular session I've mentioned before that there are 5 modules and we'll be doing 5 modules. So in order for you not to miss the 5 modules, click the like button, make a comment if you must, and then share with people. And importantly, subscribe to this channel to be able to get more of these videos subsequently. Yes, so this particular slide might interest you more importantly as it helps you to quit smoking. I'll say that 20 minutes after smoking, the heart rate normalizes, and after 24 hours of quitting smoking, your carbon monoxide level drops, and 1 year after, the risk of heart disease reduces by half. And of course, in 10 years of smoking, the cancer, the risk of having cancer as a result of smoking reduces significantly. So imagine having to stop smoking for 24 hours. what you gain is the fact that your carbon monoxide is one of those poison. In fact, it is poisonous in the sense that it chokes one if you are in an environment that is carbon monoxide. It chokes you and you can make one to seize breath. So in 24 hours, this reduces to a level that you can breathe properly. In 1 year of smoking, reduces the risk of having heart disease by half. So it means that if 10 people were to have heart disease before, if they stop smoking, half of them would be free from having heart disease. And in 10 years, your risk of having, lung cancer reduces significantly. When we say significantly, you agree with me that that means that you stopping smoking for a period of 10 years might make you free from having, lung cancer in your lifetime. Now, since you have identified the risk of smoking and you probably have identified your ways of helping yourself, I would say that the next thing would be that having made a decision to want to quit smoking or having attempted quitting smoking in the past, I would implore you to identify your smoking triggers. Some persons will be because of peer influence, some persons because of social event, some persons it has become like a morning routine for them, others is because they are in a bad mood, they smoke. Now, you have identified yours. Having identified yours, you should also look at a quitting method that suits you mostly. And I'll tell you that the best of quitting methods would be for you to gradually reduce the dose of your cigarette. I was having a discussion on our support group platform, and I popped a question about so, so what is your progress in the last 2 weeks? And somebody said, I used to smoke 15 cigarettes in a day before, but I'll tell you that yesterday I only smoke only five. That was very interesting to know. Very, very interesting, very nice. But as I'm telling you, even at the time that the person was smoking five, the person had the support of the group. He had the support of the group. Now, we've not been able to look at the nicotine replacement therapy yet, but of course, when we get there, this person will have more support even to be able to quit. Now, seeking support from the group I just mentioned, it's when people mention things like that, we celebrated the person that was able to go from 15 to 5 stick, that we celebrated the person, that would motivate another person to also want to do the same. So this is part of the benefit of being in a support group. And if you really want to be in a support group, you could just drop a message and then we'll get across to you. And of course, we would also prepare you for withdrawal coping strategies. So by this, I would say that we've come to the end of this presentation, and I would implore you to subscribe just not to miss the sessions as we proceed. Thank you very much, and have a great day.